back to my channel, Mental Health with Melissa. I'm Melissa. First things first, if you're new here, please don't forget to hit that like and subscribe button. I post new videos every Sunday, and subscribing to my channel really helps me get mental health information out there to our communities of color and tons of free LCSW test prep. I am a therapist in LCSW. I recently passed my dissertation defense for my PhD psychology program, and I have been able to get back into posting new content on my channel. And so I want to go ahead and get right into the topic of this video today. So today we're going to be talking about long-term versus short-term therapy. I'm going to break this video up into two parts. So the second part of this video will be posted next week. It's going to be the LCSW test prep question that pertains to knowing your sorts of therapeutic interventions, because you will need to know your therapeutic interventions as it relates to the LCSW test. But before we get into the actual content, I am going to be talking about two types of therapy interventions in particular, but there are several. And the several that are on the test, you're going to need to know, obviously. And I go into detail about each of these interventions on my LCSW test prep available for purchase. You can find it at the link down below. It's entitled Social Work Study with Melissa. And I go over all of those interventions that, again, will be on the test, along with many other topics that are on the test, as well as a full 170 question mock exam with videos with full rationale behind the answers. So make sure that you check that out. So today we're going to take a look at long-term therapy versus short-term therapy. And as always, because I just finished a very long and intensive PhD research program, I really like to take my information and the videos that I kind of present on from one of literature and evidence background. So before doing this video, I actually did look into some of the scholarly works and literature that were available regarding long-term versus short-term therapy. And something interesting that I found was there wasn't really a lot of newer or more recent literature. A lot of the literature was around 2008 to 2016, I think. So it's not as much in the past 5 years. And a lot of the conclusions I found in these articles and through these research really stated that more research is needed to confirm findings. So I just want to kind of leave that as a disclaimer. So what is long-term therapy and what is short-term therapy? So in a nutshell, long-term therapy, and these sorts of terms obviously probably already say a lot as to what the description would be to what type of therapy you're getting. So long-term therapy, you're probably going to be getting a longer term care. You're probably going to have a therapist that you're going to be working with for an extended period of time. So you might have found a therapist that you really like, and you don't necessarily need to see them every week anymore after you've established kind of like that rapport, and maybe you check in with them after the first couple months working together, like you were meeting weekly, and then maybe you decrease it to bi-weekly and then once a month, and then maybe as needed. And so maybe you've known a therapist for 2 years and you kind of just go back to them like every few months. So that's an example of long-term therapy. Short-term therapy is a certain amount of sessions that you have allocated to working with a therapist. And so you might specifically work with a therapist for 10 sessions, whether that be spread over the course of 3 months or 4 months, but you know that there is kind of like this end goal to end that therapy. So an example of short-term therapy is cognitive behavioral therapy, and an example of long-term therapy is psychodynamic therapy. So I want to define what these two different types of therapies are. So again, psychodynamic and cognitive behavioral. And again, I want to mention that there's more than just these two types of therapeutic interventions. So you're going to want to make sure that you know all of those therapeutic interventions as opposed to just these two, because you will need to know them for the test. But for the purposes of just kind of keeping it simple right now and going into what long-term therapy may look like versus short-term, we're going to use these as examples. So psychodynamic therapy was really a term that was really utilized by Freud. And so you're going to want to know about Freud. That will also be on the test. And this is really insight-oriented therapy. So this is long-term therapy because you're helping the client understand why they're doing something, and it really takes a high functioning client to do this. So the things that you kind of focus on are like the past and a lot of childhood maybe experiences and how that affected where the client is today. Defense mechanisms, that you're going to need to know defense mechanisms for the test, but that really comes from psychodynamic therapy. And this is kind of like a non-directive approach, and you let the client really talk about what they want to talk about. And then you ask them questions about how this relates to their past, or how they believe their experiences have shaped where they're at today. And so by nature, that takes a little bit more time and more work. On the other hand, cognitive behavioral therapy, or shorter known as CBT, is a type of therapy, again, that is more short term. And so this is when you work with a client to focus on changing, first identifying their thinking patterns and their beliefs and changing them if their beliefs are unhelpful. So this is really targeted for people that experience depression and anxiety, maybe situational depression or anxiety. So people that you might have a client, for example, that is having a lot of anxiety related to being a new parent or something like that, and believes that has this belief system or thinks that they're a horrible parent. And so what you want to do is focus on the evidence that actually supports that, and focus on the evidence that negates that. And then you can come to a conclusion about, is this really a helpful thought, and is it really a true thought? Because just because we believe something doesn't make that true. And so this is, again, focusing on how our thoughts affect our feelings, and then how that affects our behaviors. And so with this particular therapy, there's homework involved in terms of in between therapy exercises. I'm sure you have seen the CBT triangle. You can always look it up if you haven't. And those CBT charts about writing down thoughts, and then the emotions that are elicited, and then the behaviors. And, because this is a very kind of action-oriented sort of therapy, and as a therapist, you're kind of leading the therapy and assigning these exercises, it ends up being shorter term in nature. Now, I do want to just say a disclaimer that you can use psychodynamic and CBT therapies together, or maybe even other sorts of therapies, if they're not used in their most purest form, and you as a practitioner, believes that the client that you're working with would benefit from using CBT charts, but also maybe the beliefs that they formed were formed from childhood, and so you really have to use both. So then it would be a combination of the two, or again, whatever else in sorts of interventions you would want to use. So like I mentioned, a lot of the articles really state that there's more research needed to confirm findings, but I do want to at least go over just a few of some of the short-term and long-term psychotherapy works, literature. And so I'm just going to quote a few for you. So there's a article from 2008 entitled Effectiveness of Short-Term and Long-Term Psychotherapy on Work and Ability and Functional Capacity, a randomized clinical trial on depressive and anxiety disorders by the authors Paul Knecht et al. So essentially, what this study aimed to do was to compare improvements in work ability in 2 short-term therapies and 1 long-term therapy. And so what they found was that workability was statistically significantly improved according to the WAI, so the WAI screening, and the SAS work and perceived psychological functioning skill. No differences in the workability scores were found between 2 short-term therapies. And conclusively, short-term therapies give benefits more quickly than long-term therapy on workability. But in the long run, long-term therapy is more effective than short-term therapies. Again, this article concludes that more research is needed to confirm the studies or confirm the findings. And then there's another article entitled The Outcome of Short and Long-Term Psychotherapy 10 Years After Start of Treatment, that essentially concluded after 10 years of follow-up, the benefits of long-term psychodynamic therapy in comparison with the short-term therapies are rather small, though significant in symptoms and workability, possibly due to more frequent use of auxiliary therapy in the short-term therapy groups. And again, further studies should focus on the choice of optimal length of therapy and selection of factors predicting outcome of short-term versus long-term therapy. That's something that I'd like to see more research on. And I think because I also search long-term versus short-term comparisons of therapy, maybe there has to do with with the way that I was searching these sorts of terms, where maybe I could have searched CBT versus psychodynamic. But essentially, it's important to know kind of like what the benefits and the barriers are to each. So with psychodynamic, of course, the benefits are that you have more time with the client. Maybe one of the drawbacks to psychodynamic is that if you are allowing the client to take more of the lead and doing things just strictly to the pure psychodynamic model, then you're not able to really challenge that sort of unhelpful thinking that may come up. And then with CBT, the benefits are that it's very directive and has a clear path of how to treat some of those belief systems. But a downside, maybe you don't have enough time if you are conducting CBT, say in a CBT clinic. So your clinic is going to be very specific about how many sessions they allot to the client. So I hope this information was helpful. Please leave down in the comment section if you have any questions. Again, in my test prep program, I have all of the interventions that I go over, and in the part 2 to this video, I will have a LCSW test prep video for you, so stay tuned.